so also disposal of this face mask, very important. Use of things like making sure the surfaces is very very clean. So we are going back at work. We should take time to clean our surfaces, our desktop, our laptops, everything as much as frequent as we can do this. We should try as much as to do so. And also going to symptoms. This is a pandemic, so we'll probably come in contact with somebody that has symptoms. The symptoms are cough, fever, shortness of breath, which are just the key symptoms. These are not all the symptoms. It's also, as some people are saying, lack of taste, lack of smell has been reported. But the main symptoms that we are using as the red mark to know if you want to investigate for COVID are cough, fever, shortness of breath, and also your clinical experience. And so based on that, I want to say there's no cure for COVID right now. There's no cure. All we are doing, we are just treating symptoms of COVID. We are making, the most important thing about COVID is that it can dehydrate you quickly than you think. So you have to take a lot of water. So that's why even when we admit it, we give a lot of fluids, because it can actually cause a state whereby you get dehydrated, thereby causing injury to the kidneys. And also fever. Fever can be treated with simple things like paracetamol and ibuprofen. There's a scheme that says ibuprofen is not useful now because it's an anti-inflammatory medication. So it's actually not really true. You can use it because it's a good drug to stop fever. So when you're in contact with somebody with COVID, you have to isolate yourself for 14 days. No visitors, you don't have the luxury, just be in your house. Even if it's possible, isolate your kids to make sure you don't share things. So these are the symptoms you need to monitor during that time. And when you notice any of these symptoms, you need to alert the health worker just to keep record, monitor yourself. If it gets worse, then you can go to the hospital. Going quickly to the basic home growth solutions. Personally, I come from work every day. I do steam inhalation. Why? Because it has been proven that the virus doesn't actually survive, doesn't like it. So even if I use a lot of masks, I use a lot of my goggles, I use my nets, I still come home, I do my steam inhalation. But first and foremost, you have to have your bath. So all this I'm trying to say is that regular hygiene, good hygiene. Wake up in the morning, have your bath. When you're back from work, have your bath. As much as you can do, wash your hand. As much as you can do, use your hand sanitizers. That is the backbone. Now going to our face mask. Yeah, this is a normal surgical face mask. And I have two types. This you can tie, this has its own ties. The most important thing, I like this you can tie because it can be very tight. So around your nose, so that you don't have any contacts. Yeah, I'm going to demonstrate how to use it. There's a bendable part, which is like a flexible wire that is into it. It goes on the bridge of your nose. You have to make sure it seals it, right? So putting that on my nose, and then I'll make sure I form a cup around my nose to seal it adequately. Then I tie it around my neck. That is this. That is the surgical. This is just a normal surgical face mask that everybody uses. Some people are saying that it is the FFP2 is better than this face mask. Yes, FFP2 is a good face mask. That FFP means face filter piece. So they are all face filter pieces. So they just have this different standard. This is the FFP, but it depends. This from our day-to-day working. I work in my normal COVID ward with this. I don't use FFP unless I'm seeing patients that are actively bringing out things. So like I'm saying, this enough can protect you if you use it properly and adequately. That means you have to make sure there's no space between your nose and your face mask, and space, no. So this space, you don't want it to be that, as there's a space between the face mask and the nose. So I work with different methods to make sure it's tight. There's this little tie bow that we can just put at the back, making sure it's tight. So that is how we protect ourselves at work. And like I said, hand hygiene. I will still always go back to my hand hygiene. And also, um, COVID-19 has been, see, studies shows that immunity also determine your your prognosis or the outcome of this disease. So ways of improving our immunity, such as taking vitamin C, taking a lot of, yes, I think there are some researches that are saying things that boost immunity, garlic, ginger, drink a lot of it. I saw one of my nurses, she said previously, she said she doesn't eat leaves. I saw her with a bowl of salad and she said it has been shown that eating healthy boosts immunity. So eating a lot of salads is good for us. We Africans don't like it, but fortunately, it's a good thing. And also, the reason why this is there to my heart is because with a circular went around saying that Black people among Asians, they are at risk when they have COVID. They have poor prognosis than just a typical white person. So definitely, when this thing gets to Nigeria, we can't stand it because I've seen it. The best way to help Nigerians is prevention. The cure, even in the best world, we don't have the cure. Like I said, we plan the escalation plan. It's not every patient that comes through the door that we put on a ventilator. We look at the risk. Is this patient with comorbidities? Is this patient with having any underlying health that would impact the outcome of the ventilator? Because a lot of people can't stand the ventilator. Ventilator is even far-fetched. There's another equipment we use. We call it a CPAP. That is delivering high flow oxygen. A lot of people can't even stand it. It is available, but we can't withstand it. So that's why for Nigeria, the best approach to COVID-19 is prevention. How can we prevent it? Through preventing the spread of the droplets, using face protection, using eye protection, and using surface protection. Like surface, I'm emphasizing on surface protection. Right now, I don't care if you're a cleaner, I love you so much, you make my life in NHS beautiful. I see them and I know they are gold star people because they go around and they make sure that there are no droplets on these surfaces. So maybe that's why I've not had it for a while, because I'm conscious of this fact. I'm constantly cleaning my surfaces. I'm constantly using my mask, and also I use my goggle because I'm working directly with them. So that would be my approach towards it. Immunity. I take a lot of vitamin C. I'm taking it personal because I feel I'm at the front line. I see them and I've not had it. What do I do? This is what I'm sharing. I take a lot of vitamin C every day, and also I do my stimulation regularly. If I can get a garlic drink, I don't like garlic, so I won't really. But studies have shown that it boosts immunity. Anything that boosts immunity, please let's engage in it. Please let's take it, because our immunity is the base, is the background of COVID, determines the outcome for COVID for people generally. And I feel I've touched most of my grounds. Have I? Or there's
Okay,
some
thank
questions?
you. Thank you. Thank you so much, Dr. Bigbola. Good afternoon, everyone. My name is Bimoshin Sami. Apologies that you're just hearing my voice. I've had technical problems, as you do, and I don't have a video, and I'm particularly gutted because I haven't tried to look professional since the lockdown. So I put in a lot of effort to look good today, but unfortunately, here we are. Thank you so much for that session. Highly informative, from a first-hand individual that has experienced it, lives it, breathes it, and I don't think we can get anything better than that. So if we were in a room, we'll be putting our hands together for Dr. Bigbola, but we're going to do a thumbs up on the chat or something. If we can just get people just say something and just and just give a thumbs up for a really well-covered session. I think we reserve the right to bring you back on board. Today, we're really, really limited on time. So due to that, we're going to move on very quickly. I can see some questions coming in on the chat as well. We will try and handle it, but it's all according to time, because as you know, Zoom does time you out. So we're going to be really strict on time, just so that we can get all our speakers in. But we promise to answer all the questions, perhaps privately, and come back to people in the event that we can't do it while we're online. So without further ado, we've heard the medical side of it. We've heard what it is. We've heard, what the symptoms are, what you need to do. Regular hygiene is obviously very, very much top of the agenda. Homegrown remedies like steaming, on daily basis when you come in contact with people is key. So we've heard about the physical part, but I think one part that we don't tend to focus on is the mental impact. And especially in Nigeria, I beg to say that we can be very, very ignorant when it comes to medical issues, because we all have this idea of mad people walking on the street. But of course, we know that mental illness is hidden, and a lot of people carry it. So I would like to invite Dr. Oyatoku to please come on and just give us about 10 minutes and tell us what we should expect, how we should be coping, how would we know that people are impacted, how can we stabilize people's emotions and assist them, and even as a boss or somebody that is in charge of other people, how can you look after you? So over to you, Dr. Oyatoku, and thank you for joining us.
Hello, my name is Bolutife Oyatoku, and I'm a consultant psychiatrist, and I thank you for having me here. So I just want to talk briefly about the mental health aspects of COVID-19 in Nigeria. And since the beginning of the pandemic anyway, a lot of people I've had to address a lot of people with psychological issues related to the COVID-19 pandemic. Okay, starting from previously healthy people, they've had anxieties and especially fears about infection. Sorry, I'm just trying to share they've had fears about infection. So they've had fears about being infected with the virus. Some people, especially with the advent of the lockdown, they felt one thing that most people said was that they felt like they had lost control, that they couldn't control things that were happening around them anymore. Sorry about that. So like I said, quite a number of people kept telling me that they felt like they had lost control of their lives, and that was particularly upsetting for different people. Then with the advent of the lockdown, a lot of people were bored, they were complaining of frustrations, and then particularly inadequate supplies, because okay, when the lockdown was going to start, a lot of people stocked up, and then as the lockdown kept getting extended, people were running out of stock. And then to make matters worse, couldn't even get the basic items in nearby pharmacies or nearby supermarkets. So that those were the things that a lot of people coped with during the lockdown. But fortunately, the lockdown is going to be lifted soon, and so we are going to go back to like some semblance of normal life. So what can we do? We're going back to face the world, basically. And I've heard some people say they're not sure they're going out because numbers keep rising. Yes, that is true. Numbers keep rising. What can you do to protect yourself and to remain resilient during this COVID-19 pandemic? One thing I want you to know is that your fears are valid. It's normal to feel that way. It's normal to be anxious, especially now. The anxiety about being infected, it's going to be worse now because yes, we've been allowed to move around. And some of us, our bosses insist we have to come to work because the economic downturn that has occurred with the pandemic is huge. So some people have to go source for their daily living and stuff. And so you can only be sure of yourself. You don't know what the other person is doing. So we are also at increased risk of being infected. So if you are scared, you're worried about all these things, those things are normal and they are valid. What can you do to protect yourself? You have to be positive. Think of, okay, this fear is there. To gain a sense of control, try to do something to protect yourself. Like the experts have advised, wash your hands, sanitize surfaces, use face masks. You doing those things gives you a sense of control that, okay, at least you can control this part of your life. You can control this particular thing. You don't have to, COVID-19 doesn't have to take everything away from you. You can wear your mask, you can wash your hands as many times as you want. And doing those things gives you a sense of control. And then you can look for solutions. Think positively. about what solutions you can give. If you're worried about having the infection, then you can make a conscious effort. Thank you very much for that. If you're worried about the infection, you can make a conscious effort about, you make a conscious effort to wash your hands. It's something you can do. So you think of a solution. If you think, okay, I'm going to work, I don't know who is coming to work, you can carry your hand sanitizers along. If as maybe a boss or something, you can get extra soap and water to wash it, make it available. In Nigeria, we don't necessarily have all those things, but we have these buckets that have taps. A lot of businesses have started working with that. So as the boss that is going to resume on Monday, you can provide that to give people a sense of security. One other thing we can do is that we can remain connected to each other, even though it's advised that we stay apart, social distancing and stuff. You can do virtual meetings like we are doing. You can make video calls. You can call the person you haven't called in a while and do all those things. You need to be resilient. We need to try to build resilience, and then don't personalize these things. That's very important, because we know that it's not only us that is affected. If you ask other people around you, COVID-19 has affected them in one way or the other. A lot of people had business plans. A lot of people had to travel, plans to travel, and those things have been shelved now because of this. So don't see as if you are the only person that is affected by this. A lot of people are affected. And then as we go out, as we interact with others, don't try not to take what others do personally, because we can cope with stress better than each other. And so if we can cope with stress better than the other person. So if one person is not coping with stress very well, they might want to take it out on you. They might want to act out. So don't take it personal. Just try to say, don't worry, I understand. Even if you don't understand, just understand, and don't try not to take it personal, because if you're frustrated, the other person is frustrated, then you begin to get in each other's faces, and then tempers would flare, and then it gets worse. So know that take back the power from coronavirus. It has come, it has disrupted so many things, but you can decide that, yes, you're going to limit the extent to which it affects you. You're going to limit the extent to which it disrupts your life. And then, like you said, the lockdown is going to be relaxed. So going back to work, for some people that have had the virus, going back to work, they're okay, I'll come back to the matter of stigma. But returning to work, like we say, they tell us doctors that assume everybody that comes to your hospital is the patient. So you also, as you're going back to work, assume everybody you meet is infected, or assume the person is infected and asymptomatic, so that what I tell people now, I won't talk to you if you don't wear a face mask. That is giving me some sense of control, because truly I might, if I think about, okay, even people that wear PPEs, frontline workers get infected, and I think, okay, so there's no point doing anything. But at least that gives me a sense of control, that at least I've done my part, the rest is left. I'm not going to do that. So that's one of the other things you can do to gain control about it. And then, okay, I am a frontline health worker. I go to, ever since the pandemic started, I've always gone to work. So coming back home, my kids don't go to school. Older relatives are staying with me. So I know that I have the risk of bringing it back home to them. So that fear, that anxiety is there. So I overcome that by trying to be deliberate about all these safety measures. And then now could be the time to move closer to your God. For people, you could think of, okay, previous episodes, how have you coped with stress? Some people have coped with meditation, some people have coped with yoga and stuff, and some people have coped with religion. So whatever helped you to cope with stress in the past is something you should bring back now, and then be deliberate about it. Take deliberate steps to cope with it, because this is just a temporary phase and it is going to pass. So you need to strike a balance between listening to the news, hearing all those figures, and then choosing which one to believe. Someone like me, I've stopped having regular updates. I've just stopped it because I have a tendency to panic. So to keep myself sane, yes, I do what I can, and then I leave the rest to the greater power that I believe in. So that's one of the things I do. And then for those that have had coronavirus and those that have recovered from it, there is the possibility of stigma. Stigma is there. Even a number of my friends that are medical doctors, have been stigmatized because they had the coronavirus, even though they got it in the line of duty. So stigma is there, and stigma, try not to personalize it. Try not to take it personal. It's only that person's ignorance that is just showing. So when someone tries to stigmatize you, just see it as the person is ignorant. And so you rather feel sorry for this person that is stigmatizing you. So all in all, I would advise that you, yes, be supportive of those that have had it, be supportive of those around you, because this is a trying period for everybody. This is a new time. These times are unknown. We've never had something like this. So people are coping with it in different ways. So you be supportive, and then you should also be careful as you can. Be alert and be kind. Those are the things that have been advised by the World Health Organization to help to fight coronavirus, because it's only a temporary phase and it will pass. So while we are trying to stay physically healthy, we also need to stay mentally healthy. Let's ensure that our emotions are also healthy. Thank you very much.
Thank you so much for that session. That's absolutely brilliant. So mentally, we have some tips there that we can practically use. I said earlier on that we wouldn't have time for questions, but I think we're going to have a few more minutes for that. And what we'd like to do is to take the medical questions, so that before we bring the non-medical experts in, we would have covered the questions that have been asked. So please keep your questions coming on the chat. And I'm not going to be impartial and not give Dr. Yatoko a clap as well. So thumbs up for her for a really good session. So thank you so much. We appreciate that. The very first question we had, which goes to Dr. Ebigbola, is it possible to predict when the spread of COVID-19 will reach its peak number of cases in Nigeria? We know in Nigeria at the moment we have just under 2,000 cases and about 68 deaths. So the question is, do we know whether it's likely to spread or when it will reach its peak in Nigeria, and what sort of number are we looking at? Over to you, Dr. Ebigbola.
I think with respect to that, I've not checked the statistics for now, but looking at UK and US population, it depends. The number we're getting now corresponds with the number of tests that is being done. If we do more tests, we will get more results. So even this picture they're showing us, I'm not too sure it is the real picture, because they are not testing everybody. So that peak, which was the picture that was painted in UK, that it got to a stage, was it about 2 weeks ago, we were now going at a very high rate. We weren't really going at that rate. That spread did not like double up. It was just because people started testing more people. So that is, so now we can predict, it's still spreading at a very fast rate, but the availability of the tests will tell us how fast it is. Just give us a false information. That's what I'm saying, because they are just about 2,000. I don't believe they're just about 2,000 with that population. US still has a very large population. You can see they're testing a lot of people, and they have a lot of people positive. So with that, look at the population of US. Look at the population of Nigeria. Do you actually believe you're just about lower than 2,000? No.
And I also want to add to that the figures that we are getting from the NCDC are not true. With a population of almost 200 million, we've tested less than 14,000 people. And we've tested less than 14,000 people, we have about 2,000 cases. So those figures are not very true. There are some states, we've heard that some states are limiting the number of tests per day because they don't want to have so many cases. The reason we have such high cases in Lagos State is because Lagos is actively testing. Most of the tests have been done in Lagos. Lagos has opened centers where you can book an appointment, you walk in, and then you get tested. States like Kano, they lag behind. That's why we are having like more cases in Kano now, because they are testing more. So it's true that with more tests, would have higher results. But even I want everybody to expect to have an increase in the number of cases in the coming weeks. But the truth is, a greater percentage of people that have COVID-19 they improve from it. They have only mild to moderate symptoms, and they do improve. So that's the good news. Okay. So we are going to have more cases. We're going to have more cases.
I read something from a frontliner from US, and they are at the peak of it. So I wouldn't respect them more than I am now because they are seeing a lot of cases. Like I said, the peak is increasing, but the mortality is low.
Right.
Mortality means death. The number of people that die from it.
Yes, in US, they have the top compared to their population. Their mortality
okay, can
is
I just interrupt both of you for a minute? So I think what I'm getting from that is that the statistics generally shouldn't be taken with a pinch of salt because there's a lot of truth in it, but it's not 100% coverage. And I think if I heard right, there's a correlation between the number of tests that we got and the number of people that are infected or are declared infected and the number of deaths that we have. We know that in the UK, for example, they do not publish the number that have recovered, for example. But we've seen recovery worldwide. We've had 3.4 million infected people, and recovery has been a third of that at over 1 million. And I don't think that's celebrated enough. The death is about 250,000, 240,000 thereabouts worldwide. So as far as we're concerned, I think where we are in Nigeria, if I heard you right, is that as long as we're not testing people, we can't tell whether they've got COVID-19. Therefore, the numbers are unreliable. And that is also similar in the UK because they were not capturing.
It's everywhere.
Those that were dying in homes, etc. So the more people you test, the more people will know that body. So thank you both for that. The next question again is, how long can the virus last on surfaces such as boxes, books, and bags? I think Dr. Bibola, that's for you.
Yeah, so thank you for another frontline, Dr. Bimbola Ore. She answered the question, so I'm just going to read out her answers. On steels and on stainless steels is going to last about 2 to 3 days. On plastics, 3 days. Glass, 4 days. Paper money, 4 days. Surgical masks, 7 days. So really, like I said, days or no days, most important thing is wash and clean regularly. That is the only way. It can last for, it is, I don't think it's, that's why my consultant spoke to me yesterday that the major source of transmission is from surfaces, not even through these aerosols. So that's why this question is important. The more we clean, the more we involve in sanitation, the better the lower the rate of transmission. Okay.
Okay.
And then also one other thing we can clean with are the hypochlorite solutions. In Nigeria, we call them GIC, we call it hypo. So for as many entrepreneurs as are around, please let's make sure it's readily available, and then let's get our cleaning staff to clean as much as possible. That's very important. Not just washing, just cleaning the surfaces with hypochlorite solution.
Okay, wonderful. Thank you very much for that. I think those were the medical questions that we had. I'm not sure whether we had another one, but I'll keep feeding them through. Let's just try and move on a bit because it's about 4:45. And at this point, I'd like to invite our people expert. He's a HR expert and a Periscope associate, long life associate. I can't see his picture yet. So I'd like to introduce Mr. Wale Temowo to give us his views on how people will be managed. What is the expectation at work? What are some of the arrangements that need to be made at work after the lockdown to accommodate some of these things that we've heard about hygiene, cleaning, for example, that you've mentioned, and how do people really conduct themselves and each other? So over to you, Mr. Wale Temowo.
Okay, thank you. Good day, everyone. I hope I'm on and I'm being heard. Thank you first, Periscope, for putting this together. It's actually been quite a learning for me, and I've gotten so much in the last 40 minutes or thereabout from the medical personnel speaking. So from the people perspective, which is what I'm actually going to talk to, managing people, because this is really all about people. It's people that are getting infected. It's people that are prone to getting infected. And it's people that, move our workplaces. So every organization, responsible organization, actually owes staff, not just your staff, the people who provide janitorial services to you, the people who your security guards, the people who interact with you, your vendors, external parties that visit your work environments. As a responsible organization, you owe them a duty of care, in this period. It's always been there, but it is heightened, at this time. So very quickly, I'm just going to talk about what organizations should be doing before resumption and at resumption. Nigeria has relaxed lockdown for a bit, so quite a number of organizations will probably be going back to work on Monday. Prior to now, and this is what should have been expected, I'm aware because I also have colleagues who manage HR in various organizations. Communication is very key. Communicate. Stay in touch with your staff, find out how they're doing, what's going on with them. Are there guidelines that government is communicating? Re-emphasize those guidelines, to your people. Let them know more about these things, even as they are working from home. I had something very interesting last week. I was attending a webinar as well, and someone was just giving legal perspectives to the employer's responsibility to employee. And it's interesting to note that the Nigerian labor law actually gives employers the responsibility of ensuring that the workplaces for employees are safe. And guess what? In the last 4 weeks, the workplaces have been the homes. So there is that vicarious liability on the employer to be sure that the homes where your staff are working is safe. It sounds funny. How do I know how my staff set up his or her home? But you have that responsibility. Fine, you can't be there to ensure that things are actually arranged as they ought to be. But if you communicate more frequently, you will find out what's going on and if things are actually going on right. So those are things that should have happened prior to resumption, ensuring that your people are fine. If anybody has health issues, help reach out to the NCDC line. Some of the feedback we hear is that it's pretty difficult getting through to NCDC, even for people who begin to exhibit the symptoms in Nigeria. So as the HR person or as the manager of the organization or a business owner, those are things that you want to take care of or be responsible for your staff. Now, people want to go back to work on Monday. What do we do? Number one, as you had a responsibility to be sure they were fine while they were home, you also need to be sure that they are finer as they return to your workspace. So first thing to do really is ensure that the work environment is disinfected. As a matter of fact, NECA is Nigeria Employers Consultative Association. They sent out like an advisory sometime last week, which also listed some of the guidelines that they expect organizations to put in place as people begin to resume back to work. First thing is ensure that there is a disinfection done in the office. Offices have not witnessed much of human activities for the past 4 or 5 weeks, so let's clean up the place. Dr. Bolu talked about hypo and all that. I didn't even know it was as basic as that. If you cannot get professionals to come do the disinfection, they are the very minimum. Get people to clean up with hypo and all of that. And at the very minimum, wear your nose masks, wear the hand gloves as they do all of those cleaning. The regular fumigation we do to take care of pests and rats too might also be important now, because I was made aware that it's less talked about now, but Lassa fever is also still raging in Nigeria. So when you've left offices for 4 or 5 weeks, some offices might have been invaded by some of those rodents. So it's also good to do that fumigation ahead of resumption. Now, what are the resumption protocols? Some of these things we were doing before the lockdown. Now we need to keep it up. Like Bayo said in his introduction, the fact that the government has relaxed lockdown doesn't mean that it's over. No. Figures, in fact, some people believe that it's the wrong time to leave the restrictions because the figures keep going up every day. But we have figures going up. So we need to actually heighten those protocols before people enter your premises. Let your security people take their temperatures. And your security people ought to be protected. They need to be wearing their masks. They need to be wearing their gloves. Let them take everybody's temperature. Of course, I remember entering during one of this period. During this period, some weeks ago, I was about to enter a store, and they were taking our temperature. You know, you wash your hands and take your temperature. And one lady was like, oh, why are you taking temperature? People that have it, they don't manifest immediately. Yes, we do know that, I mean, you could be asymptomatic and you're carrying it, but at the very minimum, let's do what we can do. Like Dr. Bolu said, people even who wear PPEs are still getting it, but you do what you can do, and then let God do his bit. So, I mean, have that protocol in place. Let temperatures be taken. If it's above the trigger point, which I understand is 38, that person shouldn't be granted access into your premises. When people enter into your premises, I've seen some organizations set up washing areas where people can actually wash their hands and all of that. If you're able to set that up in your premises, fantastic. Let people do that before they enter. But if you are not, at the very minimum, let them sanitize their hands before they enter. One of the things that I have also recommended is that opening of doors, into your office premises. Let one security person who is wearing gloves do that, so we don't have too many people opening those doors. Our doctors have told us today that transmission happens a lot through surfaces. Offices that before now were using biometric access, disable biometrics for now. Disable biometrics, because that's also another way by which several people are touching a particular thing, and there could be transmission. So disable biometric access for now. And then working hours resumption. I was speaking with some friends yesterday, and we're talking about protocols for resumption. Don't rush all your staff back to work, yet, especially for organizations that have a large number of people. Maybe for smaller organizations where the social distancing within the office space is fine, but generally, don't rush everybody back to work. Face your resumption. Let some set of people come in first, so that you have enough room to reduce the physical contacts, So, and then when people are in, timing of operating hours for now should be reduced. The guidelines that the federal government and state governments have also released says 9 to 2 p.m. for the most part. Yeah, so let's keep it as minimal as possible, 9 to 2 p.m. As a matter of fact, people say, you know what, you don't have to work 9 to 2 p.m. For now, let's be flexible. Come in 9. If you're able to do what you need to do for the day before 2, then you can take your leave and go home. And also, in bringing people back to work, I also advise organizations to be particularly concerned about staff that are not mobile, those that will have to commute through public transport. I think those people are very exposed, so I would rather bring those people in last rather than bringing them in first. I mean, let those people still stay back at home until the general situation has improved as much as possible. Also, in terms of some of the protocols around your business operations, this is a time to reduce visits, unofficial visits, as much as possible. As a matter of fact, even if it's official, let's explore things like what we're doing. Have your meetings remotely. Make that part of your business operations now. We do our meetings remotely. If it really has to be physical, then it has to be as minimal as possible. Your meeting room should be not as crowded as you would have had it before. Social distancing is one thing we keep hearing from the experts. Social distancing. And then even by the time you're able to bring in the full complement of your staff, organizations may need to rearrange seating arrangements, such that we ensure that there is a minimum of, here is 2 meters between you and the next person. Before this started, someone sent me an article which I've not read through, but the title of the article was, is this the end? Something about, is this the end of open plan offices? Open plan offices have been the thing a lot these days, and it looked good. It's ensured that workers were able to bond. There was that boundary spanning. But now it's looking like it may not be the best going forward. So do we want to have more secluded spaces so that people don't get exposed to each other so much? So those are some of the things that organizations need to look at, as we move into what is going to be the new normal. I think I can stop for now. If there are questions, I will take.
Absolutely. Thank you so much, Tunde. That's a very quick stop tour of people business, and I think that's so crucial. We have a couple of questions and some leading back to medical But I think the question for you, you've probably answered it, because someone's asking the question, what do you think organizations can do to balance staff retention and staff cost? The fear of job loss is high, especially considering the ILO report. Did you get that, or did you want me to repeat it? Wait, you need to unmute.
Okay, yeah. I was having problems
Okay,
on
so you got the
muting.
question.
Yeah. Do you want to take the question again, please?
Okay, so it's, what do you think organizations can do to balance staff retention and staff cost? The fear of job loss is high, especially considering the ILO report.
Okay, yeah. I mean, it's not the best of time for businesses. It's not the best of time for countries. You know, economies are suffering, businesses are suffering as well. And what I advise to organizations is, number one, as much as possible, cut down on necessary costs. Now, the very first instinct of most business owners when you hear costs is think about the people. Oh, yeah, staff costs. You know, no, but there are some other costs that you can actually cut before you come. I believe that staffing should even be the last you should come to, especially at this particular time where people are actually struggling. People have families to take care of and all of that. And if your immediate response is, oh, we're not making business, so you guys should go home, it's the optics don't look good. It doesn't portray such an employer as someone with a milk of human kindness, as they say. You know, so I think first thing is to look at aspects of the business where costs can be cut as much as possible. These days, staff wouldn't be traveling as much as they used to do, so you're cutting costs on traveling. You've been away from your office for the past 4 or 5 weeks. In Nigeria, where we burn diesel to run business, you've saved cost on diesel. You know, perhaps you used to send your staff, you know, on trainings out of your location. Some of those things, privileges, they wouldn't be able to enjoy it this time around, you know. So those are areas where you could cut, you know, and then to make up the numbers. But if after cutting in all of those places, the numbers are still not making sense because revenues are not coming in as they should, I think you should put a human face to whatever cuts you're going to have with staff. Have an interaction with your staff. Let them see the numbers themselves. This is what we used to make as a business. This is what it has come down to, you know. And there are other options before you can resort to what I would call the last option of telling them to go finally. There could be cuts, I mean, pay cuts. Okay, can we do 70%? Can we do 50%? You know, and we could treat that as deferred, where you're cutting as deferred compensation. So when business picks up and we're able to recover, we can bring that back to you. But if it doesn't recover, it's a sacrifice we all have to take. Secondly, which is also another painful one, but less painful than a total disengagement, is sending people on leave without pay. Even in the US and the UK, I mean, these are being done. So that gives a sense of you still have the job, but the company cannot pay you now because the company is not making money. So you know what, let's take a break. Go on a holiday, it's unpaid. When things get back to normal, you still have this job, we'll bring you back to this job. You know. But in the final analysis, if the company has crunched all the numbers and they are totally not making sense, then you may have to do a disengagement. But when you disengage, make it cordial. Try and cushion it for the people you are letting go as much as possible. Let them have some payoff, you know, to restart their lives. That would be my advice.
Okay, thank you very much for that. There is another question here that says, I'm concerned about social distancing in offices. How do we maintain the pool office arrangement? And I know during your talk, you did touch on the open office arrangement. So I think this is close to it. My guess is, you know, it's about having fewer people in the office or having rotation and not having 100% workforce turn up. Yeah. But if I'm wrong, if you want to add to that, please do.
No, absolutely that is so. For companies where the sitting arrangement is such that we can't have our full capacity sittings at the same time and achieve the required social distancing, then don't bring everybody at the same time. You can have people work shifts. Hours can be flexible. So maybe some people come in the mornings for a few hours, others come after a particular set has exited. So those are the kind of dynamics that organizations need to put in place, at this period. So if you don't have the space to ensure that there is actually a safe distance, then please don't bring everybody at the same time. Let them resume in phases, let them run shifts.
Okay, wonderful, thank you. And to Dr. Bolu, thank you. I can see you're answering questions on the chat. So please, can those that have spoken just keep an eye on the chat. If there's any question they can answer offline just by messaging, that would be great, and we can read the answers out. I think one of the questions we had was, how long does the illness last for once people get it? And the answer was, it depends on the individual immune system, and each person will heal in their own time. But the presence of underlying illnesses such as hypertension, diabetes, asthma, could make the virus last longer, eventually lead to death or perhaps some sort of lasting illness or something like that. So it really depends on our level of immunity. And I think, if I'm not wrong, age probably, but I guess the older you are, the more you're likely to have this underlying issue. Okay, so thank you for that, Dr. Yatokun. I am now going to call on our last and very, very patient speaker. I'm an accountant by background, so it's quite nice that the medical people have spoken, the people have spoken, and it's quite nice to hear from the economists. We matter, and everything we do is around the economy as a whole. What is Nigeria doing? I think we had a question about what is Nigeria doing about frontline workers, for example. What's happening with people that are losing their jobs, etc. We know in so many countries that they are putting arrangements in place to provide some sort of financial incentive or financial provision for people that suddenly lose their jobs or otherwise. But we know that provision is not particularly 100% in Nigeria, so it's harder. But I think what our next speaker is also going to focus on is the fact that we have been very quick in Nigeria to put in place a lot of temporary measures, or what appears to be a permanent measure, but he calls it's all packaging. Is it sustainable? So I'm going to invite our next speaker. He's a socio-economist and an investment banker, so he's loaded. And he's going to talk to us about the government, responses and implications, and most importantly, sustainability of whatever has been put in place. So ladies and gentlemen, please join me and welcome silently Dr. Seun Osho as he takes his session. You have about 10, 15, I think we're going to be kind to you. You have about 10, 15 minutes, sir. Thank you. Over to you.
Thank you very much. I wish I was a doctor, and I wish I was an economist, and I wish I was an investment banker. But I work in banking, and I work in business transformation. And I'm very interested in public policy, so I spend my time reading a lot of things going on. And a couple of weeks ago, last week, I wrote an article. I'm just writing down my thoughts. So it's probably not going to be a subject matter expertise, as you've heard from the last two speakers, but it is. I think it has some valid opinions. So where do I start? So basically, I think if you look at what's gone on since the virus began, most of the Western countries have had the health effect or the health shock first before the economics. But that's sort of different for African countries in general. We sort of done the reverse. We've had the economics hit us first before the health shock. So it's an interesting thing to see. And then specifically if you look at Nigeria, before the crisis, we knew that we were in a precarious situation. We knew that we were not growing at a GDP rate that was good enough to reduce poverty levels. We knew that we had high unemployment. We knew that inflation is high. We knew that we depleted our foreign reserves. We knew that we had no money in our excess crude oil account. So all of these things, I think the average Nigerian sort of knows. So we were not in the best position to react or respond to the crisis. So I guess sort of my criticism or my challenge is that our response to the crisis has been to copy what the West has done. So largely sort of fiscal interventions and monetary policy interventions. So the central bank, for example, goes in and injects 4 trillion into the banking system. And then the government does a 500 billion naira intervention, which is sort of fiscal, and they do some changes with tax policy. And it all reads nice on the textbook, but if you think about the kind of country we are a really poor country, and most people work in informal sectors. So you can't really use your banking system in Nigeria as a system or transmission for public policy to people. Now you can do that in the United Kingdom, where only 1.8% of the population doesn't have a bank account, but in a country where 60% of the people still don't have bank accounts, it is not a sustainable policy to transmit public policy through. So that's just an example of where I think we're probably missing it. So I think that our response to this crisis should be very different. I think we should focus on our people. I think about it largely in 3 terms. There needs to be some sort of short-term response, which we need to survive. Only the living can build an economy. And then the next sort of point is we need to return to some form of normality. Normality, whatever that means. Normality is going to be different for the whole world. And then the final point is we need to reimagine what sort of country or what sort of economy we need to build. So I've sort of really talked about all of those things, but I'm going to concentrate on surviving. So I think, because I've said, okay, family and household. So the basic things that the average Nigerian household spends money on is food, healthcare, and housing. Those are sort of the big ticket items for the average Nigerian family. And just to sort of, take it back a point, so that we don't have a very Lagos-centric view of the conversation. The country is more than Lagos and Abuja and a few hotspots in Port Harcourt. But if you think about the average Nigerian family like that, that is what I think economic response should focus on. We should focus on getting people food. We should focus on removing housing commitments and direct transfers. So let me talk about food. So some of the things I've suggested is that the government needs to focus on buying more food in the strategic reserve. So there's a strategic reserve, grain reserve that it has now. We need to do much more. And if you've been following what's been happening in East Africa, there's probably a drought coming to Africa. So it's a very unfortunate time. So yes, we need to be aggressive. The Americans, for example, about 4 or 5 weeks ago, almost sort of stole PPE equipment meant from Germany at the ports in Asia. So countries are getting really aggressive. So we do that. We need to do that. Second thing is we need to invest money or send money or direct transfers to local producers. So all of your farmers, all of your poultry farmers, that should be the focus. It should be food. Majority of Nigerians, I think 65% of household income goes to food. And the next thing, housing. So if you think about it, the West, basically, there's a lot of policies that are focused on mortgage holidays if you live in a kingdom, where you can call your bank and they can give you 3 months grace period at 1% or 2% interest rate. But most Nigerians don't build their homes through mortgages. Most Nigerians, if you build a house, they're building it with all of your equity. So you can't really do that. There's sort of a different, if you think about housing, the urban percentage or the urban population in Nigeria is about 50%, and the rural population is about 50%. So this is probably going to touch more on the urban population, where rent plays a big part of people's expenditures. So this is the controversial bit, but I propose that the government needs to enable its war powers here, or its emergency powers, and there needs to be a moratorium, free months for working families and average Nigerians where they don't have to pay rent. Now, the implementation of that, we can get into how operationally possible is that. You first start with your security security services. No one is evicting any tenancy evictions. The justice system, nobody's evicting anyone. No courts are going to be taking on those cases. Yes, there's going to be a negative for the landlords, but if you look at the population of landlords as compared to renters in a place like Lagos, you see that the policy in the aggregate would be beneficial. And then I touch on direct cash transfers, and this is sort of where I'm big on. So I think if you look at our country, we've been trying to alleviate poverty, and we've done sort of different programs doing conditional cash transfers. So the current one is the social intervention program. Now, the challenge with that is it's opaque. We don't know. It's not a lot of accountability. The data is 4G. They tell us it's 3.6 million spread across different states. Some states don't have. And so, but this is where we really need to go. We need to scale our direct transfers, and this is where I think we can leverage on technology and innovation, especially the telecommunications space. So 2 years ago, the central bank provided guidelines for payment services banks, and one of the requirements is a 5 billion capital requirement for organizations to participate in this. So some of the things I think the central bank needs to revisit all of that regulation, so that you can have smaller players come in there and drive a lot of innovation, so that it's easy to do transfer and payments of cash to a larger subset of your population. And then sort of a second point on direct transfer is for small businesses. So if you think about the way Nigerian businesses work, most banks don't lend loans to Nigerian businesses anyways. Most Nigerian banks invest their money in government treasuries, or in a few large corporates, or an account charges. So your caterers, your barbers, etc., none of those people don't have access to credit, as compared to what's happening in the United States or United Kingdom, where you have where the government have now instituted small business loans where people can access $10,000 or £10,000. I got offered £10,000, just out of the blue. You can access that credit facility. That is not available to Nigerians. So direct transfers, and this is where I think we can also leverage technology. The FRS and LRS example have a lot of data. They know how to close people's accounts when they're chasing for taxation. So yes, they have enough information to use in those institutions to estimate the wrong cost of some of those small businesses, and we can then leverage on the telcos to do direct transfers to as many of them as possible. Then finally I talk about government costs. There has to be rationalization in the government. If you look at 2020 budget, you have 27% of it is recurrent expenditure. We're paying salaries for civil service. So let's say 1 million people work in the civil service, 200 million Nigerians. So we cannot be spending 27% of our budget on just 1 million Nigerians. And we can't, so I would advocate not doing sort of massive layoff now, because we need a lot of consumer spending. We don't want to, we need spending, we need stimulus. But there needs to be at least start from your strategic transfers. Look at those. So I think 2 days ago, the federal government approved the implementation of the Orasanye report, which is a step in the right direction. So all of that needs to go. And finally, I think the larger point I hope I've been able to make is that, yes, it is good to copy some of the things that the West is doing in terms of economic response, but we need to understand where we are. We need to understand the constraints we have. The government is going to have to borrow a lot of money, not a lot of money, it's going to borrow some money. We are going to have to go beg a lot of international organizations for forbearance, for debt relief, for moratorium on interest payments. And in aggregate, I hope that I hope that we were able to get some of those funding so that it can give the country breathing space to respond adequately to the crisis. Thank you.
Thank you very much. Oh, wow. Okay, that's a completely different light to what we've been hearing. But I think, we must give you a round of applause as well. So please feel free to comment on there. Thank you so much for that. So we applaud you. Thank you. Well covered as an expert, because I don't think the doctors can do what you do. So, you know, you're definitely an expert. Now, everybody can see me, so I'm glad. I wasn't going to give up. I had 2 laptops in front of me. I had to make sure that you saw my face and it wasn't just an imaginary person. So good to kind of be visible to everyone. Just a question for you that came up. A question here says, should the international creditors such as IMF grant, should they grant more debt forgiveness schemes to African countries due to the economical impact of COVID-19? Oh, Rabbi, can you unmute?
So I guess, you know, there's always this debate about going to the West for aid and getting debt reliefs and all of this. But I think we can't be ideological here. We can't, you know, there's no, now I've dropped any sort of ideological bent. I think right now we need to survive. So yes, we should go to the international communities, and we need to get as much help as possible. But what I would say is, in the case of Nigeria, because we have we've had irresponsible leaders, some of those funding should come with some form of conditionality for reform. Now, I don't want an IMF program, because it's not worked in most countries. So I don't want a sort of normal IMF program. But if we could have some conditionalities attached to maybe more spending on healthcare, more spending on education, more spending on specific things attached to those loans or grants, I would be in favor of that.
Absolutely. Thank you. And I think we've seen that COVID-19 has brought the world together and is bringing professionals together, and it impacts every single person, every household. I'm just going to open the floor for a few more questions to any of our speakers before we wrap up the session shortly. So please don't leave yet, because this question might be useful.
Uncle Lighter is in the building. Yes.
On the call. Yeah. So who would like to ask a question, please? If I can just have your name on the chat, and then I can call you and you can then speak, please. Or better still, can we unmute everyone? But then if you wish to speak, please indicate by typing on the chat. Okay, does that mean we don't have questions from anyone? Right, we have a question from, can we unmute everyone, please, admin? Muted, sir, Mr. Akinusi.
Yeah, good evening, everyone. My name is Akinusi Oluwole. My question is to the medical doctor. What do you have to say in respect of the choice and the quality of nose masks adopted currently in the country, I mean Nigeria? Federal government came out last week. I've been seeing series of nose masks ranging from Ankara material to normal clothing material. And we're not too sure of the quality, if this will actually protect us against COVID-19. Do you have any comment in respect of that? Recommendations or what we should do? Thank you.
Okay. So Dami, is the question for Dami or me?
I think we can
Maybe I'll just answer
both
that.
answer.
Okay. So well, the recommendation for face mask is because it's not the face mask that the federal government is recommending for everybody to wear is not because they want to protect you from having the virus. It's a form of protection, but the primary purpose why people are being told to wear face masks is because they don't want asymptomatic carriers to spread it. When you wear the face mask, the amount of droplets that come out of your mouth when you are speaking or coughing or stuff reduces significantly. And like Dr. Dami said, it's when these droplets touch surfaces that others can get infected. So wearing a face mask doesn't really, it's not that it's protecting you. The mask will prevent you from inhaling, but it prevents you from spreading the droplets from your mouth or your nose to other people. So it's more of a public protection thing. On the long run, if you can't spread the virus, then other people will catch it. So if other people can't spread it, you also would not catch it. So that's the rationale behind wearing all these Ankara face masks, because it's better than just allowing you to speak and then spread the virus everywhere. When you speak, the droplets stick to your face mask, and so it doesn't have a chance to get to the surfaces that would otherwise be contaminated.
Okay, so just to add to that, so there are types of face masks. There are single-use face masks and there are reusable face masks. So I would assume the Ankara ones are in the category of the reusable face masks. So the most important thing is how we take care of them. Once we, it's not say you should always wear the same face mask every day, but you have to make sure that it is, you clean it adequately and thereby you can reuse it. So I think that is where the material come into place. All these ones I showed earlier, they are single use, but there are also some that are reusable, but you have to make sure you wash it and you sterilize it.
Thank you.
Okay, sorry about that. Do we have any other questions, please?
Yes, I have a question.
Okay, go ahead, sir.
I would like to ask if contact tracing can be effective in Nigeria. Like in South Korea, here where I am, what they did was if any cases is being heard, they trace the contacts and then they isolate them. But now in Nigeria, when we don't have the contacts or data of people, how do you do contact tracing in Nigeria?
Okay, so that's it's a very hard one for us here in Nigeria, really. And well, the government is trying as much as possible, but all these things are hampered by dishonesty. Like, okay, I remember initially when people were coming into the country and they wanted them to drop their contact. Some people put wrong numbers. I have friends who work with the NCDC, and those are some of the frustrations. So yes, contact tracing it's being done in Nigeria to the extent where the government or where we can do it, but it's not as effective as other countries because we don't have those basic things in place. Yeah, we know that some countries are tracing people by their calls and stuff, but we have so many unregistered numbers here in Nigeria, so it's hard. The government is trying, but it's not as effective as it should be, obviously.
Oh, okay. Another question is relating to the number of people being tested. Do you think Nigeria's problem is that we can't afford testing kits, or it's unavailable for Nigeria as a government to buy the kits? Because in South Korea here, they tested over 400,000 people and only 10,000 were positive. And another thing they did was they did drive-through testing. So as you're driving through, they just put the swab, they get the, you understand? So what is the problem in Nigeria? Is it that there is no money to get testing kits, or the government is not ready to get kits, or I don't even understand. So what is, I don't know.
Okay, so it's not really that. Number one, we are short of testing kits. That's the truth. We don't produce them here. So we have to get them from other countries, and there's a global shortage of test kits. And so we are like on the lower part of the ladder of those that they would give. Yes, there is some concern that because Nigeria, we are the most populous black nation, and we could affect the rest of the world. So yes, they are trying to prioritize us amongst African nations, but we are short of test kits. And then even there's so much politics at play with regards to this testing and stuff. So that's why we are not having so many figures. Because at the end of the day, like I said earlier, that most people would recover. So quite a number of people that have this virus would recover and they won't even be tested. So they won't be part of the statistics that the government would put out.
So if I may ask again, you said because of the global shortage. So how was South Africa able to get over 300,000 testing kits? How was Egypt able to get over 200 testing kits? How was Ghana able to get over 50,000 testing kits? And Nigeria got, I don't know.
One of the things I said was also that there is, it depends on the political will. The process has been politicized. So it's what we have we will deal with. It's what we have we would work with.
Absolutely. And if I can just come in there, I think we'll remember when this got to Nigeria, the only people we heard had it were those that could afford it. And so a lot of people were calling it rich man's disease because it was only the rich and the known that could afford to have the test. So I think it's impossible to compare Nigeria to every normal country. That's not to say we're abnormal, but you know what I mean. So unfortunately, we are where we are. I think that's a more difficult question to ask because, you know, those that be in power are not here to answer that question. So thank you very much for that, Doctor. I appreciate it. I'm going to take another question really quickly from Ms. Adeni. Over to you, sir. Mr. Adams, ask your question.
Good day, everyone. First, I'd like to say thank you to Periscope for putting this together. I think it's a brilliant initiative and it's educative as well. My question is to Mr. Temowo. Since we're talking about possible homegrown solutions to COVID as opening back or attempting to open back our economy, what would you suggest to companies as people will be going back to work? For example, what we are doing in Abu Dhabi is before anybody can go back to work, they're going to get tested. The facilities are going to be sanitized, and they also have a continuous plan to sanitize every week, and to also practice safe distancing within the facilities, each of the facilities. So my question is, how can Nigeria adopt any of these practices? One, continuous sanitization of the office areas, and two, continuous, first of all, the initial testing for each of the employees going back to work, and how to adopt a continuous testing program, given the limitations that are currently, which is currently a challenge in Nigeria, getting people tested.
Okay, thank you. I mean, the first point you highlighted, which they're doing in Abu Dhabi, testing everybody before they go back to work. I mean, that's brilliant. You know, it's something you would wish we could do in Nigeria. You would imagine that should ideally be the very safest thing to do. That before people go back to work, test everybody. You know, unfortunately, I mean, like Dr. Bolu has highlighted, that doesn't seem to be. That seems to be very far-fetched in Nigeria because, to start with, people who are exhibiting symptoms are having a hectic time getting tested. I understand that there are actually protocols or prerequisites to getting tested in Nigeria. They say it's either you have a travel history, you're coming back from an endemic country, or you are exhibiting symptoms or one of the particular criteria like that. You're not exhibiting any of those. Sorry, you don't get tested. Why? Because we don't have enough testing kits to go around. So sadly, I honestly don't see how Nigeria will be able to test every worker going back to work. But that said, I was talking to someone last week who said he had that the Central Bank of Nigeria plans to do that for all their staff. Now, I mean, CBN is big. CBN is the government's banker. So I imagine that they'll be able to leverage on that government a relationship to do that for all their staff. But would every company in Nigeria be able to do that? I strongly doubt it. You know, which is where personal responsibility now comes in. Okay, we can't get everybody tested, but at least the very basics we can do. Take their temperatures before they come in, you know, and ensure that our office is well disinfected before they come in. We would do that. Then continuous cleaning and disinfecting of the offices. So that also is now a personal responsibility of every organization. If your cleaners will just clean in the morning and then it's done for the day till the next day, they need to do it more frequently now. And another thing that, I mean, I hadn't thought about this before, but I think it's also a good idea, is if organizations could actually have hypo or this disinfectant handy, the ones that you can spray, you know. So if there is one on every desk, or at least at close distance to every worker's desk, so you take that responsibility for yourself. You make sure you spray your seats, you know, every now and then, before while you're in the workplace. I think those are things we can do for ourselves to help ourselves. Sadly, we don't have the resources of the Emirates. So we'll live within our means and try and protect ourselves as much as possible.
Everybody.
Absolutely, and I think that's the case in Nigeria. It's about taking personal responsibility for each and every one of us and our neighbor. I have a message from Mr. Ogunleye who says, Mr. Tamawa, you are on point. You've explained that, you know, perfectly well. There's no way that we can do what the rest of the world is doing. We're just not built that way yet. I'm going to take another question, but perhaps this will be the last question that I take. I'm not sure. I have two names because we're aiming to finish in the next 10 minutes or so, just to wrap up the session. I'm going to ask Mr. Laolu Lewis to ask his question, please.
Hi, good evening, everybody. Apologies for coming late. I don't know if I missed this comment I want to ask about, but the real question for me here is we're getting to a point in Nigeria, especially Lagos, where we're running out of the isolation center space to have people isolated and treated. So we might be coming to a point in Nigeria where we would have people being home and having this infection. So is there this is to the doctors, is there a recommended treatment process or advices you can give to people that even if you find yourself in that situation, there are activities you can do within your home by yourself and get through this problem?
Yes, that would be Dr. Bibola to answer that question for us, please.
Okay, thank you, Laolu. I actually had a slide, please, some notings based on that. So like I said, here is not all patients we actually admit. We actually keep some at home, so that is quite important. So they normally come with fever, cough, and breathlessness. For the fever, like I said, We take some paracetamol and ibuprofen. We drink plenty of water and fluids, and we get rest. For the cough, find a good position, sit upright, a teaspoon of honey, and although this is not recommended for children lower than below the age of 12 months, yeah. So for breathlessness, this is very important. Open the window, but please don't use the fan because the fan actually spreads the virus. So we encourage open the window, get fresh air, but don't use your fan because it actually spreads the virus. And slow breathing, like to help with the breathlessness. Breathe slowly in through your nose and out through your mouth, like you're gently blowing a balloon, gently. That calms somebody, that makes the breathlessness better. And also sitting up and also relaxing your shoulders. So these are the advice from like I said, from NHS to people isolating at home, which can also be applied because we don't have the facility to have everybody isolated, which is similar to Ola Louis' question. So, and if after some days, the symptom gets worse, then you can get to the doctor. Usually, we expect worsening in symptoms about 10 days after the infection. So at day 10, even we will try to contact you to find out how you're doing. And so you can stay at home, isolate. If your symptoms resolve, fine, you don't need to stay in the hospital. But if your symptoms worsen, then you need to see the doctor. Is that fine?
Thank you, doctor. Yeah, thank you. Just to ask as well, we hear about heat treatment as well. I wonder if you could touch on that. I know you probably mentioned steam, but how about being told to have a hot bath, maybe kind of put yourself in a hot bath or have a steam with a mentholatum? I don't know, whatever it is. Is there any insight you can give us on that, using heat to treat it?
The story behind that is that the virus doesn't like heat. Yeah, so steam inhalation, having a hot bath, the bath aspect, I just need you to use soap and water to make sure you wash even your hair. Make sure you have a thorough bath. That would answer it. So I'm not really a fan of hot water bath because then you can burn your skin, which can cause another problem. But actually having warm water is good enough for the bath. Steam inhalation, like I mentioned, it's good. Mannitol, like some people react to it, so I can't be throwing that out there. There's something that is good. Also putting some salt in the water. This acts like some saline, some helps to reduce the pH. Or I think. So that could also be used. So if you want to put some mannitol in it, clears the nose faster. But the concept is the heat itself from that you're inhaling, not really the mannitol or any other thing.
All right. Thank you very much for that. Okay, we have 2 more questions, and I think that will be the last one, and I'll read out another one. I think doctors, if you can just have a look at the chat, there are a couple of things in there that you can answer. There's a question on AC, which I think links to the fan, so I'm going to leave you to answer that, doctor. But in the meantime, Orelua Guleye has a question. Please ask your question.
Hi, everyone. So I think my question is the financial aspect, and it's for Mr. Osho. So a lot of companies are laying off staffs or reducing salaries, cutting salaries, and I'm just wondering how do people ensure stable financing within this period? There's a lot of uncertainty. We don't know how long the meltdown is going to be for, or how things are going to be. So how do I ensure that I'm financially stable or things like that? How do I have enough cash reserves? What do I do? What can I invest in? What can I not invest in? What should I do with my money right now?
That's a good question. Is Mr. Osho taking that?
I'll start and people can jump in. So to be honest, I think we are in an unprecedented, world right now. Like it's affecting every country. If you spent, I don't know, if you've read the news from the United States, 22 million people filed for unemployment benefits in the space of 3 weeks. And the same in the United Kingdom. We're expecting the worst second quarter GDP growth since World War II. So it's a really tough time. I guess the difference is there's a social network, or there's a social what do you call it? There's a welfare system in those countries, and that's what we don't have. So what most developed countries have done is they've done all sort of things. There's a follow program, so your company only pays 20%, the government pays 80%. You can claim unemployment benefits. You can get mortgage holidays. Some landlords are also offering moratorium on payment. So it's almost a case of just surviving. It's keep as much money as possible as you have. So in the UK, for example, they postpone payment of VAT. If you call the tax authorities, you can move the payment of your your corporation tax. I'm going to do that. So and that's why I went back to the question of, my criticism was around what exactly are the things that the average Nigerian needs. It's food, it's rent for now. So I guess for now, it's basically surviving. I probably wouldn't worry too much about investment now because you're a retail investor, you don't want to lose money, the market's all over the place. So just, cash is king right now. Your bank account, what you have in your bank account is probably the safest thing to do. Yeah, that would be my point. Anyone can jump in.
All right, thank you for that. I mean, I'm just going to add to that, and then we'll take the next question because we've got a matter of minutes. I think just to add to that, what the reason why she was probably asking that question about investment is we've had people talk about investing in shares at the moment, that it's the best time because the shares are low, apart from people like Netflix that are doing well. Well, you make a very good point that it's very volatile at the moment. So keep your cash is probably the first thing. And then if you've got some spare flying around, perhaps you can then, play around with it on the investment market, but it might not be your first go-to because this is lasting longer than we think as well. So I'm going to ask Ayodeji to please ask his question, and that'll be the last question we take, and then we're going to have closing remarks, and then we'll wrap up the evening. Ayo, please ask your question.
Hi, it's Ayo Banjo here. So I think there's two aspects to this. I think the first thing I want to do is a point of clarification around the testing. Different countries have different approaches to how they're dealing with this virus, depending on their demographics and their healthcare system. So countries like South Korea are taking an approach of test, track, treat, right? So where you test people, you track who they've been in contact with if they're positive, and then you treat all of those people. They have their population is small and their healthcare system is solid. Whereas in the UK is not taking that approach because of the population. So what they're saying is if you have some symptoms, just isolate yourself until you feel worse, then contact the healthcare services or contact your doctor, because there's no country on this planet that can handle the number of positive coronavirus patients. They don't have the capacity to. So I think with Nigeria, even if we tested everyone and then we've got everybody that was positive, we do not have 1/10 of the bed capacity to take them all. So I just wanted to clarify that. My question now is more of a public policy, epidemiology. So both Osho and the doctors can answer this. So there's a school of thought that, if somewhere like Nigeria, right, where our aged population is very low, and our healthcare facilities are not great, what is the point of a lockdown? Shouldn't we just take the herd immunity approach, where the weak will fall ill anyway, and then the capacity we have should be able to handle them? Because just an example, the majority of the people that this thing hits are over 60, 70, and in our population, that's only 2% of the population. Whereas in the developed world, they're more like 18 to 20% of the population. So if they actually got infected, their healthcare system would collapse. So should we just take the approach of herd immunity, where a large proportion of the population will contract this disease and then just build antibodies and fight it. And those that don't need some support fighting it, the healthcare system will do the rest.
Okay, let me just, at least from the medical point of view, I feel the lockdown was really needed. And I think we still need it, but unfortunately the economic situation is making them lift it gradually. For places where they're talking about herd immunity and stuff, their healthcare systems are quite good. In Nigeria, I can assure you that as of today, we have less than 300 ventilators. In the whole of Lagos State, we don't have up to 100 ventilators. So saying that let's build herd immunity, yeah, eventually we'll get to that point. But what the lockdown did was to slow down the number or the rate of increase so as not to overwhelm the health system. Our healthcare system is poor. We have reduced number of doctors. Not just doctors anyway, most of the healthcare workers have migrated. So for those that are on ground, the lockdown was to protect them from being overwhelmed, because if the healthcare system is shut down, then it's going to be a nasty thing. Yes, like I said earlier, most people that have this infection would improve, but in a country of about 200 million, and we want the herd immunity, if maybe let's say if maybe 5 million Nigerians do get the infection, and then we say 10% out of those 5 million would need to be ventilated, that's 500,000. We do not have the capacity to treat that. That's why that lockdown was necessary then.
All right, thank you. Did Mr. Shaw want to add to that?
So Obanjo and I, we've had this conversation a couple of weeks ago, and I think he's moved me on the subject. I think eventually, especially in Nigeria, where 90% of people work in the informal sector, what do you do in Lagos, where I think the second employer of labor is entertainment? All the alaga ijokos, the musicians, the caterers. So you can't lock down that country for more than maybe 3 more weeks at the most. So I hope that herd immunity is proven to be actionable. I'm still reading about it.
Thank you.
For example, I've said that people still get infected after the first time they get it. So if it gets proven, then let's have a go. Yeah.
Okay.
Thank you, Osho, for that point. I was about saying it, that this thing is still a new disease. This herd immunity story is questionable because there's now real infection. So let's just tread softly on this herd immunity, and let's see how it turns out, what we get from this first wave. Yes, we all still experiencing. Thank you.
Okay, thank you very much for that. I mean, from me, as a moderator, kind of like a part-time moderator that came in when it already started, I want to say a big thank you to all of our speakers, all of our attendees. It's amazing. We set out to do this for an hour. We're almost 2 hours in, and we still have about 90% attendance. But we're very mindful of our Muslim brothers and sisters that will need to get off at 6 o'clock. So we really do need to bring this to a stop. So a thank you from me, but even a bigger thank you from our CEO, our chairman, whom someone has referred to as the COVID-19 ambassador. Please let me bring on board Mr. Bayo Adams to finish the session just like he started it. Over to you, Mr. Adams.
Thank you very much, Madam Moderator. Thank you very much to everyone. Like you said, I mean, we are indeed grateful to everyone for this. Putting this together, I mean, within such a short time frame, I mean, and having over 50 people in attendance. Even our physical gatherings and meetings have not been able to achieve this. Well, as we said at the beginning, again, it is important to say, these are strange times, these are new times. A lot of things are happening differently. And just like Moshe was saying about our approach to managing the finances, you know, we should just take everything as it comes. No one knows how long this is going to last. You know, one of the considerations now is that this is the first, what do you call it medically? This is the first, I would say, this is the first bit. We don't know, there might be a second or there might be a third. So we don't know how long we're going to be in this for. And I mean, truly it is, I mean, it's a difficult time for everyone. Strange things are happening, which means some people are even keeping beards, you know? I mean, that's why for me that article is very, very hard, you know, all in a wash. You know, so we need to know how we're going to manage all of this. But what I'm going to say about the timing is the fact that tough times don't last, but tough people do, which is one of the reasons why we're doing this. Let us stay together as a community. Let us encourage ourselves. Let us be there. This is one of the times where, I mean, it's funny enough, you know, it would have been better if we were reading this as part of our social studies exam. What did they do in 2020 when they had this? But unfortunately, we are the actors of this time. You know, and one of the best things we can do is to continue to have this type of series or these sessions where we discuss, where we bring thoughts and share our thoughts and problems or challenges, if I could say. So that's why for us at Periscope, we've started this today, and we hope that we're going to be having this series every other week. We've started with the medical part of it because it's actually a medical issue. The next might be on technology. The next might be digging deep into the economic bit of it, you know, just to keep ourselves together. So that's part of, I mean, what we are going to say. And again, for us in Periscope, which is why the first topic is what we are discussing, going back to work. You know, the fact that the federal government is relaxing the lockdown does not really mean that coronavirus is over. So we should go and, you know, we should be very careful. There's something David Cowan said, and I would like to read it. It might be a bit harsh, but I think it's the truth. He said, this virus, if you don't respect it, it will kill you or someone you love. You can be tired, it is not tired. You can feel like going out, but it will be out there. Until we have herd immunity, either through a vaccine or exposure, you are taking a chance. So this is my parting word to everyone. Please let's be careful. The fact that we're going back to work does not mean the battle is over. And like the France Prime Minister said over and over again, mankind is at war. We are at war. And it's a very strange type of war because we cannot see the guy we are fighting, as little as he is, but he's bringing down people. We've had lots of more deaths at this time than we had during the World War II. That's what we are facing. So when we're talking about the medical bit, so I mean, talking about strange times and different things, for me as a person, almost every night now I do, heat inhalation. Some strange things that we don't want to do. The amount of the garlic I take that covers the perfume I use. Guys, nobody wants to go. So we need to take, and like someone said earlier on, for those of us in Nigeria, you know we are our own government. We are our own local government. You are responsible for yourself, your health, your safety. You know, talking about palliative measures, a lot of the palliative measures we're having in Nigeria are for political purposes. A lot of them, show me, carry me, all are wash. You know, so these are the things that we need to put in perspective. But we know, again, this is not a battle for Nigeria alone, it's a cross-board. And that's why we'll continue to do this to find our homegrown solution to this problem. Look at what is happening in Senegal. While the ventilator is selling for $60,000, they've come up with ventilators for under $100. What are we doing with our herbs? These are some of the things that the pharmacists need to start looking at. Look at what Madagascar has done. They've come up with a solution that they use for treating malaria. So this is some of the things that we need to look at. The solution might be from Africa, it might be from Nigeria. But as we find this solution, please let's stay safe. And that's what we are saying from Periscope Consulting. As we say once again, thank you very much for joining us. Very short notice. And I would like to improve on this by saying, in the next 2 weeks, we'll be doing another invitation for another topic relating to this COVID-19. I will try and keep this on until this battle is over. But by the grace of God, we would overcome. Thank you very much, everyone. Thank you.
Thank you all, and good night from us from Periscope. We look forward to seeing you at the next session. Good night and have a lovely evening.
Thank you.